Hi, everybody. I'm Jennifer. I am the Director of Research at the Clean Commerce, and we're here to talk today about ways that you can get involved in helping our health and the folks who are keeping our economy going so that the rest of us can shelter in place and do what we need to do while this COVID-19 runs. So today I am joined by Linda Goelzer, the Director of Public Relations with Carter BloodCare, Daniel Hall, the Vice President of Resource Development for the Boys and Girls Club Central Texas, and Tara Stafford, Director of Community Benefit for Baylor Scott White Health. I'm going to have each one of you guys kind of give a little bit of introduction about, what you do for your organization, what your organization does on a normal day, and then how you've kind of pivoted to adapt to this COVID-19 situation, how you're serving our local community. So Tara, do you want to start us out?
Sure, happy to. Good morning, everyone. Thanks for joining today. Well, my role as a Director of Community Benefit is often, it's usually going to be geared around assessing the community need, which is going to be a little bit more, not as specific as COVID needs, but the needs that people have to maintain a healthy life. Access to care, of course, is something that we're on top of all the time. We are a nonprofit health system, and so we track the community benefit that we give back to the community. And so my role is often primarily based on that, community health programs, working with community partners to provide programs out in the community. I also manage our charitable giving program as well. And so just a lot of community involvement and partnerships, which is something that is it's great to be able to do and has benefited, honestly, very much. Now that we're dealing with a different crisis, we have flipped it around a lot. And while we're doing a lot giving back in our community, it's amazing to see how the community has turned that around and said, what can you do? How can we assist you guys at this time? And you want me to go into that a little bit more right now, or pause for a minute and let others share?
Let's pause and then let everyone else kind of do introductions, and then we'll jump back, kind of circle around to, I guess, the more specific things that folks can do. I am hearing a little bit of feedback, so if I could ask everyone to just mute their mic until they're speaking, that way maybe that'll help with that, and hopefully folks on the other end won't hear it. Linda, do you want to go next?
Sure. First of all, hats off to Tara and to those in the healthcare hospital settings who are truly on the front lines and doing the lion's share of the work right now. And we just, having grown up in a medical family, I have great appreciation and revere the work they do. But so, they're in the spotlight now, and we're really counting on them, and they're counting on us to stay home. So Carter BloodCare is the blood provider to all the hospitals in Central Texas. And we also serve an area in North Texas, where I'm physically located right now, and then in East Texas as well. So we serve a 57 county area in Texas. And so obviously hospitals were our first concern when this whole thing started. And we were in a severe blood shortage when it started. And so we were concerned about having blood at all. And then when this hit, we were really concerned about ever getting blood donors out when they started doing the shelter in place. And so our industry nationally worked hard to get the message out that blood donation was an essential function during this. And so we're very pleased to say that right now our blood supply is strong, partly because hospitals have cut back so far on what they're doing, obviously not wanting to bring in any extra people into the hospital than they have to, at least right now, till we know where things are going. So there was kind of a balance that happened. People really began to turn out. They want to do something to help. And of course, blood donation is one of the things they can do. But right now we're kind of trying to meter what that looks like for the community until hospitals really get fully up and functioning. So I guess I would just say the way it has affected us is that we continue to work and do what we do, obviously trying to keep our staff safe. They're on the front lines, but with people we assume are healthy, and them being healthy themselves. So we're not obviously confronting sick people. We don't think we are, but it is one of those things we're having to monitor as we go, just like Tara and people on the front line, but hopefully not as much in the risk of danger as are our healthcare professionals.
Yeah, and I think that's a good point that you bring up. It's still safe to donate. There's probably a lot of misconception about whether or not people can or should go out, but that need is always going to be there. So it's really important that folks, that are able to get out there and do it. So great. Okay, Daniel.
Thanks, Jennifer. So as the Vice President of Development for Boys and Girls Clubs of Central Texas, I oversee the fundraising and marketing and communications activities of 8 community-based Boys and Girls Clubs throughout the region. We operate 29 sites in Taylor, Georgetown, Copperas Cove, Killeen, Harker Heights, Nolanville, Gatesville, Marlin, and Waco. Collectively, those sites, when the world is normal, serve about 21,000 of the youth that need us most each year. Like everybody else, this pandemic has thrown the way we do business off on a loop, and we've been working aggressively to find some unique solutions to serve a new category of youth that needs us most, and that's mission essential, or youth of mission essential families. So a few weeks ago, we launched Mission Essential Day Camps, and I know Tara is aware of this. We've been in discussions with Baylor Scott White about it, that are meant to ensure that the families that are on the front lines of this pandemic, whether it's supporting the healthcare response, first responders, even water and sewer utility workers, making sure our toilets are flushing, or the HEB grocers, the bankers, etc., that they have a solution to the unique burden that's been put upon them from the closure of schools throughout the country. We're pleased to provide this service. It has been a valuable one. We're also supplementing that with food program support, as well as other partnerships with our local school districts to do screenings and things like that. And it's been interesting territory. It's new every day, and we're continuing to navigate and plan for what the new normal looks like tomorrow, next week, next month, next year even.
Yeah, so what's been the reaction to that program? Have you had an influx of folks, that need this service taking advantage of it?
We built this with the expectation that we were going to get overrun. All of our kids are operating in individualized classrooms in the same way child cares are right now, with an 8-to-1 youth to staff member ratio. Right when we launched this was when the shelter in place orders were really starting to get serious, and the peak of that curve, if you will, was really getting tight. Frankly, the demand has not been as high as what we planned for, but I think that's a good thing. There's a balance of safety and a balance of serving those families that truly need us most in this time, and we found that right balance. As we begin to get into later weeks, later months, we are seeing an increased growth in Mission Essential Day Camp enrollment. As an example, we've been in discussions with HEB's corporate HR office just this past week, and we've opened up access to our day camps to all HEB employees at no cost to benefit from this service. And we've seen an immediate spike in our enrollment as a result of that. It's going to be a slow trickle, but I think a slow trickle is a safe way to approach it.
Yeah, that's awesome. And you're not getting overwhelmed, and you're kind of building it incrementally, like you said. So it's not, it's that right balance between not enough and too much. So awesome. Well, I am super impressed with everything that you guys are doing. And by the way, if you're watching or listening, please send us your questions in the chat. Or if you are, involved in an organization or movement that is doing something to help the folks on the front lines, let us know. We'd love to hear about what you guys are personally doing or what you've heard about. That's kind of what this talk is about, just highlighting the things that are being done and giving people options for how they can get involved. So Tara, let's go back to you and kind of talk about the healthcare world. You guys obviously are getting ramped up or already dealing with an influx of COVID-19, cases, and that's really changed the way that you guys offer your services. I know that healthcare, across the nation is a lot of it's shifting to virtual or telework and or visits. And then a lot of the types of services you're offering are not being offered currently because you're trying to conserve those resources. So can you just talk about, some of the measures you guys have had to take for the safety of your patients and your workers? And then I guess any initiatives, that you might have started to help people who are affected by this directly.
Absolutely. Thanks. So first and foremost, I think the biggest shift, absolutely, as you mentioned, is switching to telehealth as much as possible so that people can stay safe, stay home, and still get the care that they need. So many of our services are still available online. If you pull up any Baylor Scott White app or website, the first thing you'll see on that page is how to get services, virtually. So we definitely encourage people to use that. But we do have clinics still in operation. So if you need to see somebody, go see somebody. And that telehealth, survey can kind of help determine that as well, if you can be seen virtually or if you really should go in and see somebody. So that is important for the community to know that we're still here. We're still open. Our clinics are active and definitely do want to have patients come in and be treated if needed. So that is definitely the biggest shift that we've seen, though, is that move over to virtual care, and it's been good. I think keeping people at home as much as possible is what we want to have happen. Let's see. So as I mentioned at the very beginning, the community has just come out in droves, to do a variety of different things, serving, and also want to say thanks back to Daniel and Linda for the work that you are doing. Daniel recognized and called us, reached out to me just a few weeks ago saying, hey, we know that your workers still have to go to work, but schools are closed, daycares are closing. What can we do? Or here's what we can do to help. And it's just a wonderful service to be able to offer. So we appreciate that very much. I know many of our healthcare workers are grateful for that. And blood absolutely is a big need. Through Carter, Baylor Scott White has a blood center as well. There's a nationwide shortage, as is the case that it will be for any kind of situation, national disaster like this. And so we encourage donations, scheduling that appointment. There are precautions that are being taken, of course, to make sure that everyone who comes, close to you is protected, and that you are protected as well. We do have mobile units set up outside of our hospital, so you don't have to go inside the doors. But it is a safe thing to do and highly, highly encouraged. As COVID continues to continue to affect more people, the need is going to continue to rise. So can't encourage you enough to make that appointment wherever you can to donate. We appreciate it very much. I did my own just 2 weeks ago. So, we really do appreciate it. Beyond that, the biggest needs that we have as a healthcare system, the first one was addressed very quickly, and that was the need for that personal protective equipment. We had so many people calling and saying, what can we do? Trying to get masks, trying to get gloves, trying to get, disposable gowns and that sort of thing. School districts, universities and colleges, businesses, local dentists. We just saw an outpouring of support and people donating their supplies to us. And at this point, we're in a good spot. Not that we don't still need it, but because of that outpouring and being able to find some resources available, we're doing well. So we appreciate that very, very much. Along with protective gear, cloth masks, community members, if you're on Facebook, you've seen the many, many social groups that are out there making masks. And that's something that, we can certainly use. And I know that just the community as a whole would like to have that protection. I've got mine sitting right here for when I go out in the afternoons. So I appreciate that very much. We have set up a collection bin for anyone wanting to make those and bring them by. It's at the Hilton Garden Inn, which is just across the street from our main hospital. And you can walk in without touching anything, put it in a bin, and walk right back out. So, and we encourage you to do that if you can, if you've got that talent to sew and put them together, because we can use them for sure. So we appreciate that. Other items for donation, whether it be food, whereas HEB is just an amazing community partner. They've come to support everybody, and frontline especially at this time, through providing hot meals, through assistance with groceries, so we thank HEB for sure. We've had great support from our local churches as well, also helping provide assistance through grocery purchases for our frontline, just providing encouragement and notes of support, videos, those kinds of things we're hearing from our community, and all very much appreciated. We have established an email address for community members to submit their notes and their encouragement, because it is a need that we have, that our staff does. They've got, they're anxious. They're looking to the future, not really knowing what's coming. So there may be some fear in that respect, and certainly the risk of fatigue, as there are long hours and uncertainty and being apart from family for extended periods of time. So any kind of encouragement we appreciate. That email address is BSWH Central Texas Cares at bswhealth.org. And I'll say that one more time, and maybe you can get that up later for you, but it's BSWH Central Texas Cares at bswhealth.org. We appreciate anything that's being sent through there. The last thing that I do want to mention now, and we can come back to more maybe in a little bit, but donations, whether it be physical donations of supplies, or whether it be monetary donations or food, services, anything of that nature. We have a website set up that we ask that you go to, and it just basically asks for your name, your contact information, and what you have to offer, and an opportunity to give financially as well. And that website is you can get to from our main page, bswhealth.com/COVID-19 donations. It's pretty easy to remember. So bswhealth.com/COVID-19 donations. And we certainly are grateful to the community for the support that they've showed us, and knowing that you're behind us moving forward into this. So we thank you.
Awesome. And we have been updating the links that have been mentioned throughout the video in our live stream on the chat feature, or the comments feature. So please check those out. If there's something someone mentioned and you weren't sure, you can find those there. I want to go back to what you said about the community really stepping up and just coming together and donating and bringing food and doing whatever it takes. That's been really heartening for me in this time, because I know this is a really stressful period for all of us. We're all experiencing a lot of emotions, a lot of them negative, and just for me, seeing the good things, like our event description here said, that look for the helpers, right? Look for the people helping the helpers too. That really makes me feel like, okay, we're going to make it through this, because we have that human side of things, and we have people that are really coming together and saying, what do you need? Do you need more masks? Do you need food? I've heard, a lot of stories about these cities and countries who have gotten overwhelmed, and the healthcare workers are just at their wits' end because they're out of supplies, or they have no beds, or they have this and that. And knowing that our community is preparing for that and trying to avoid that, and that we have the support system in place to hopefully make that happen is really heartening for me. And I'm glad you brought up the masks, because I have had a lot of friends making them myself. I even have a friend who's 3D printing some, where you can insert the AC filters, and they want to know, where can we bring these, where can we donate them? So knowing that there is a drop-off point, no touch, and it's going to go straight to people who need them, is very, very encouraging. All right, so we do have a couple comments and questions. Lena says that, do you think that the virtual visits are going to continue after this? She's had a couple, and they were amazing and didn't require her to miss work.
Absolutely. We've had virtual visits as an option for a while, for employees for sure, that we've been able to use. And yes, the future of healthcare is going to change. We've been pushed into a virtual world very quickly and have adapted nationwide. Not just our healthcare system. So healthcare is going to look different, and that option of virtual healthcare, it may not look exactly the same, of course, but that is still going to be an option that's been in the works for a long time, making sure that that was available to our community. Yes.
Yeah, that's awesome. I actually hosted a webinar a few weeks ago that talked about how this has kind of caused businesses to become more innovative and adopt things quicker than they maybe would have. And I know you guys maybe already were rolling this out, but this has probably pushed you to implement it a lot quicker or bring on, even more features that you hadn't already planned to do. So and again, something good to come out of a otherwise negative situation.
Right.
Rebecca already also says virtual care has made a big difference in her life personally, and she asked the same question. So a lot of interest in this, in these virtual visits, and I think, like you said, this will be kind of the wave of the future. So thank you so much for sharing. And I'd like to go to Linda now to talk a little bit more about that you guys are doing, in your day-to-day practices. One, to maybe kind of continue to serve this population that's being affected, and also just assure people that blood donation is safe. Are you taking extra measures, or is it requiring, any specific equipment that you may, want the public to help or anything like that?
Well, most of what we need in our day-to-day world in collecting blood is not something the public could provide, unfortunately. We have been monitoring supply chains very carefully because the manufacturers of blood bags and the kind of products that we use every day are very small. It's a very small world. And so that has been something we're keeping an eye on. People may not know that if they give automated donations, such as platelets or things like that, those are single-use kits that are fitted to very specific machines. And so there aren't very many makers that do these specific things. So yes, there's been a monitoring of what's being used and what's available and so forth. I think during the some of the storms of the last few years, some of our supply chain vendors learned that having things off the mainland, if you will, are not necessarily the wisest things to do. So there was a little bit of a near disruption in supply chain in the recent years. So I think more of them have moved things back closer to home. So that's very helpful. One of the things that has changed for us, early on, we got a lot of complaints from people in the community who were wondering why we were not wearing masks, why our phlebotomists were not wearing masks, and why we were making donors remove their masks when they came in. And I want to be really clear about this and explaining this so that people understand we weren't trying to put anyone at danger and we weren't trying to make people angry, but there were so many opinions out there about who needed to wear masks and who didn't need to wear masks. And as Tara can probably relate to in healthcare, you have to pick a standard and stick by your standard until that standard changes. And we chose to follow the CDC guidelines, which early on was that, sick people wear the masks, healthcare workers need the masks. The supply was very limited. We didn't want our very well phlebotomists and donors who were supposed to be well and healthy when they come to give blood using masks that needed to be used elsewhere. And as you can imagine, in our day-to-day lives, when even if a person who suffers allergies comes in to donate blood, they are supposed to remove that mask because we have to know that the person coming in is healthy and well. And so that was a little challenge for some people, and we took a great beating on social media because of it. And I felt badly for our staff who had to face it. But they are wearing masks now when the CDC changed that guideline. And the more we're learning about this virus and how unfortunately resilient and cruel it can be, we are, asking our staff to wear masks and allowing donors to wear masks. From the very beginning, we took a very strong position about the cleaning. We obviously do a lot of cleaning anyway in our business, as does Tara in the hospital world, but we took extra measures doing a lot of wipe downs and cleanings between every single donor in every single space. And we have tight screening booths, we have beds, all of those things. And so we're doing extra cleaning, wiping light switches when people use the restrooms. I mean, it's, like everyone else, we're doing a lot of cleaning. And we've also hired crews to come in overnight in all of our donation centers to deep clean our centers every night. So we're doing the very best we can to prevent any germs that might grow there. So in our buses, we are really hosing those things down literally every night with deep clean. So we feel like our spaces are as clean as they can be right now, given what we all know. And the other thing I wanted to say is that our mobile drives are somewhat limited in number right now. We're relying heavily on our donation centers to collect most of the blood. In Central Texas, that's a little bit different because we only have one donation center there located in the Woodway area. And obviously it can't do all the collections there. So we do still have mobile drives going on. One of the things we're asking people to do very strictly is to make appointments. So even if there is a mobile drive in your area, we're asking people to make appointments for your drive. If your community organization is hosting a blood drive, we always provide links for people to sign up. So please sign up. Part of the reason is, and I know Tara mentioned earlier, that blood donations are always going to be needed. They certainly will be. But truthfully, right now, the hospital usage is so low that we don't want to risk having blood outdate. And nationally, this has been a concern everywhere. And so we always feel like our industry is a little bit unique in that, it always feels like we're asking people to turn the spigot on and off really quickly, but we can't seem to get across the word that people need to donate consistently throughout the year. Just keep donating. Don't wait for us to say we need it, and then so that we don't have to tell you we don't. And we always need it, but we also have to work with the ebb and flow of how that need goes. We, for instance, have fewer cars on the road right now, thank goodness, but that means possibly fewer accidents. It doesn't mean they're not going to happen, but there have been fewer. We have elective surgeries that are very limited in number. And while those are not the greatest uses of the blood supply, it does require blood to be available and so forth. So elective surgeries are down. We have certainly a lot of procedures like aesthetic procedures that use a lot of blood. People aren't doing that. Those aren't going on. So we want the blood to be available for those high use procedures that cannot be put off. Heart surgeries that have to happen, cancer tumor removals in large organs in your body, liver surgeries, pancreas, things like that require a lot of blood. We want that blood to be available for those patients when they need it and for those surgeons. But and we're hearing that more and more of the COVID patients, as they become seriously ill, we're hearing reports of organ damage in different parts of the body that occur because of the disease. So there could be a greater use of blood as it goes on, or we see more very, very ill patients. But just the nature of COVID itself has not increased the need for blood. It's a respiratory disease, so does not always require blood itself and as part of the treatment. But again, that could all change, and it depends on each individual patient. We obviously have seen so many varied ways that this disease presents itself. So getting to what we would like to hear people do now, I think what's going to happen in the next month is we're going to see how the country begins to open up. What does that look like? None of us really knows. But we do know that eventually we're going to need blood, and hospitals are going to want to get back to taking care of procedures that really need to happen. So when we use the term elective, I'm sure Tara would join me in saying, that's kind of not like, oh yeah, we could do it, we could not do it. No, it's more of like the timing could be a little more versatile, but it's still something that needs to be done. Or if you're someone who's living in extreme pain from back pain, but yet you can't have your spinal surgery right now or whatever. Those are still things that are not entirely elective in your mind, right? So as things begin to get back to normal, we are definitely going to need more blood. So what we're asking people to do is think ahead, and as your business reopens, if that's possible, or your industry begins to do something different, think about what blood drives might look like to your organization. Do you normally host a blood drive on a bus with us? That's great. We will still be able to do those. We probably will see times change a bit where we're not drawing as many people on the bus at the same time. Right now, we can usually fit 4 people on a bus. We might have 2. And so therefore, that means if we host a blood drive with you, we might be collecting half as many people as possible during that time frame. So we may not be able to collect as much in the same amount of time. So does that look differently? So that means we're going to need as many people as are eligible at your organization to please come and give when we have a blood drive there. It might mean that more people who have space in their building space to have an inside setup or a blood drive where we come in and set up beds inside, that might have to be more spread out than it has been in the past. That's what we've been trying to do lately, is have them in big open spaces. Well, there's a lot of open spaces right now because there are a lot of buildings that are not full of workers, but that's going to be different when people come back to work. So we will be looking for spaces that you may or may not have been willing to open up before, and now that may just look differently. We know that our community healthcare systems cannot function without blood. That's not going to change. We can't function fully and provide the miraculous care that our hospitals do today without blood. So just keep in mind that blood donation is always going to be needed. This disaster is going to come and go at some point, and people are going to say, oh, good, I'm on with my life. But please remember that now you've become aware of just how much blood donation is needed. You've made time for it in your schedule because other things are not competing. So maybe decide a time that's going to work for you, and don't fill up that time with whatever else it was you were doing. And just remember that even if you can only give 2 to 3 times a year, if everyone who was eligible just gave 2 to 3 times a year, we would seldom have shortages. And so, just allow yourself to learn about blood donation, and try to make that a part of your new life when you come back from the social distancing, if you will.
I love that. Yeah. People could just start implementing it as part of their regular routine or their schedule. I know I became eligible to donate a few years ago after the rules changed, and I was really excited, and I have tried to maintain, regular donations, but I could definitely be better at, 2 or 3 times a year, like you said. I will say I donated right, I guess, before the shelter in place started to take off, but it was still kind of that iffy period where it was like, COVID's coming, what's going to happen? And it was a little scary, but you guys were great about, sanitizing surfaces and just doing all the things that you said to take precautions. So I definitely commend you for that from a personal experience. And I think it's important that you point out that, we're always going to have people who need blood. Even if there is less demand because of certain reasons, there will always be people with certain conditions, or just, accidents are still going to happen. And I was actually going to ask if COVID was increasing the demand at all directly. And it sounds like that's not really part of the reason that there's a need. It's more because there's less donors right now.
Well, and I think the true reason there's less of a need is because of what hospitals are doing to try to curtail a risk for more people being in the hospital itself. And Tara can correct me if I'm wrong, but it sounds like a lot of our customers are just trying to, at first nobody knew how much of a weight this was going to be on the healthcare system, people flooding into the hospitals like we've seen in New York and some other very big hotspots. People didn't want to overwhelm the healthcare system. So I think hospitals were saying, let's don't do anything we don't have to do, because we might need these beds. We might need these ICUs. We might, nobody really knew what to expect and what the demand would be. And now we're also learning in our industry that there are new things coming online. There are some blood supply providers, equipment providers that are coming up with new ways that we might be able to treat this disease in the future. One is blood filtering. So there's a machine that would be sort of like kidney dialysis, but they would filter the blood of the people who are currently very ill. So that might be a new procedure. And would that require, depending on the size of the person themselves and their blood volume, would they need blood to help with that filtering, blood products, plasma? We don't know. So they're just new ways that we're doing things, and it seems like blood is always one of the things that comes into play. You know, it is our life source, by the way, and it is you know, something that happens automatically. It's manufactured for us every day in our bodies, and we can't ask a manufacturer to ramp up and produce more of that for us. It's one of the very few things that absolutely requires something of us. And if we want to continue with the marvelous choices we have as Americans in healthcare, I mean, there's hardly anything we can't have done that exists in healthcare that can't be done in America. We are so blessed with the incredible healthcare provisions we have. And in Texas, my goodness, we have fabulous healthcare in Texas. So in order to support that possibility, newborn babies, premature babies being saved, people with incredible situations happening, we seem to be, these healthcare people seem to be able to pull rabbits out of the hat all the time and save lives. And so we have to remember that if we want those things to continue, we do need to continue to support our blood supply.
I hope you guys can still hear me. I'm having, I think, a little bit of connection issues on my end. But I will just reiterate, yeah, blood donation is not something you can do virtually. It's always going to be needed. You're always going to have to go in to do it. So continue to donate if you can. Ronald says he donated plasma a lot in the 90s and would love to continue to donate. So where can folks like Ronald and others in the community in the coming days or weeks? Do you have a couple of blood drives in the Killeen area? And how often can people donate?
Well, I would say to Ronald that for Carter Blood Care, you can go onto our website, carterbloodcare.org, and there is a tab that says donate blood. And when you do the drop down, it says give blood today, and you click on that and you can put in a zip code, you can put in your city and the radius of miles, and you can find community blood drives that way or donation centers. And I'm sure that Baylor Scott White has something very similar. So that's one of the ways you can find. I will say that it's likely, and I'm not sure, but Ron said he gave plasma in the past, and it's probably likely that he was giving at what we call a plasma center. So he may have been paid to give blood. We don't pay to give blood. We're collecting blood for the community patients, like those at Baylor Scott White and all the other hospitals that we serve. So the plasma that we would be collecting is plasma that patients use in hospital treatments. So there are patients that get plasma, burn patients use plasma, heart patients might use some plasma mixed in with red cells and platelets. And so plasma is a part of the blood that is used all the time. But we don't pay donors to give blood. All of our donors are volunteers. And we might have heard a little bit recently about plasma being used to treat COVID-19 patients. And that's a very specific, what we call convalescent plasma. So plasma from someone who had the disease themselves, and they may now have antibodies to it. And so those recovered COVID patients are being called upon to give convalescent plasma if they're interested. Now that's a very specific process. So if you are a person who had COVID-19 and you are recovered, you must have had a positive test. So remember, very many people never got tested, but they were probably 99% sure they actually had the disease. You would not be eligible to give convalescent plasma as the rules are right now with the FDA. So we're looking for people who definitely had a positive test for COVID-19. And if you have a negative test, a subsequent negative test, you can present yourself to give convalescent plasma after 14 days. If you never got the negative test, but you had that original positive test, if you wait 28 days from the time you had no symptoms, and then you could go online to register to become a convalescent plasma donor. So keep this in mind. Don't just walk in anywhere. Don't walk into Baylor Scott White or Carter BloodCare. Don't just walk in and say, I had it, here's my test results, I want to donate. That's not how it works. You must be scheduled. This is part of a kind of an investigational use of this process. So if you are interested, there's information on some of the hospital websites. There's information on Carter BloodCare's website, possibly even on Baylor Scott White. But there are recruitment processes going on for people who are interested in giving convalescent plasma. And again, this is not a paid thing. It's a volunteer situation. And we really are, everybody's interested to see how it will work. And we hope that some of the very critically ill patients would be helped by this process.
Yeah, that's really cool. I hadn't heard about that, but I know there's been a lot of talk about how do you get people who have recovered or either even are asymptomatic and use their immunity to kind of help fight off for future people. That might even help with drug formation in the future. So I'm interested to see how that goes, and definitely good to know. Hopefully nobody, ends up having to go that route because they won't contract the virus, but good to know, if you do. All right. Well, thank you so much, Linda. And again, the links for everything we've been talking about are listed in our comment section. If you have any questions, feel free to throw them in there. I'm going to go ahead and kick it back to Daniel. But first, I want to point out a couple comments we had when you were talking originally. Lena says, we're lucky to have a forward-thinking Boys and Girls Club in our area. And as the economy starts to open more, this is going to be an amazing service. So I assume she was talking about the childcare for essential workers, of course. And if you want to talk a little bit more about that, I guess, and are you guys planning to kind of continue that program indefinitely, or do you have an end date once this is resolved? And then ways that the community can get involved and support your program?
Yeah, to my point prior, right now we're planning and trying to secure the resources to be able to operate in this new normal as long as is necessary. We hope that as restrictions begin to alleviate, we'll be able to serve more different types of kids without restrictions to their family's employer classification. I think one of the potential evolutions of this is we could go to gatherings of 50 or more. And if that is the case, then we'll respond in kind and develop a model that meets those requirements. In terms of the day-to-day, I would like to explain that. We have, once a kid enrolls and is able to attend the club, it's business as usual for a Boys and Girls Club experience, but with social distancing in mind. They are screened at the door to check for questions of COVID-19 exposure as well as temperatures. They have the opportunity to engage in electronics, games, recreation activities, arts and crafts, to contribute to programming that focuses on healthy lifestyles, academic success, and good character and citizenship. All 6 feet apart, all in groups less than 10, of course, but in new and unique ways. We've also created dedicated time in each of these clubs and have been working to deploy the technology to ensure that each of the kids that are at these sites has, say, 90 minutes each day where they're focusing on their distance learning requirements coming out of the school district, in doing so under the guidance or tutelage of a Boys and Girls Club staff member. Our donations to Mission Essential Day Camps have been twofold. One of them have been through public-private partnerships. In each of the sites in which we're operating, the local school district has stepped forward, and they're providing grab-and-go breakfasts and lunches to all of our club kids, which is an invaluable service. And then two, in most occasions, lending their nurses to screen our participants as well as our staff at the door each morning. That safety modeling, that healthcare modeling has been really vital to ensure that everyone has the confidence to proceed here. And we're forever in debt to KISD nurses, Gatesville ISD nurses, Georgetown ISD nurses for doing that work. We've also had, whether it's local government partners or local school district partners, coming in and sanitizing our sites. Lampasas ISD, as an example, is conducting deep clean sanitations of their club twice a day, where we might have an empty room one day or at one point of the day, and they're going room by room cleaning, following children who had been in that room prior. These are all new safety protective factors that are needed, and they couldn't be done without the help of our local public and private partners. We've been receiving food donations as well, very similar to the hospital. We've stepped up and are working to expand our capacity to serve suppers to the community in the same way the school districts are. Yesterday, we started cooking hot meals for youth ages 1 to 18 out of Copper's Cove. And on the first day, we served 175 suppers.
Wow.
Domino's out of Waco is actually just recently donated 75 pizzas every Friday to that Waco club that they will distribute to families as well. It's great things like that that are really allowing us to sustain this model moving forward and strengthening it as we go along. In terms of monetary donations, as I mentioned before, because of all these heightened safety factors that we've had to put in place, that comes with additional expenses. And thus, we've instituted a $50 fee or a $10 per day fee for day camp participants. Wherever possible, we're trying to pass that on to the employer of that individual. HEB is a great example of that. But we've also worked to build up a robust scholarship fund to ensure that any family that needs this service is not going to have a financial barrier from accessing it. And I'm going to try something here. I see a share screen button at the bottom. Let's see. Maybe not. Maybe so.
I think Jasmine might have to enable it to show up on the screen on her end. She's got the control.
Oops. And I think my Chrome just crashed. So Noel, the scholarship fund that pops up as soon as you visit our website is bgctx.org. And that funding is going to be used to ensure that every kid that has a need has access to this day camp. As an example, we received a donation from the Clean Heights Rotary last week. And immediately, a day after we received that donation, 16 new kids were able to start coming to these day camps who we had put down on a waiting list because they had a financial constraint. It's little things like that that help us continue, help us lead with this good work. And anyone that's interested, I'd encourage them to take advantage of donating to that scholarship fund.
Yeah, that's awesome. The fact that you guys have all these community partners stepping up, of course, to donate and also, give food, but in-kind services as well, nurses and deep cleanings and stuff, that benefits you guys, but it also keeps those folks working and keeps the kids safe. So it's really just a win-win-win all around for everybody. Marlene says, thank you, Boys and Girls Club, for all that you do for our kids. Yeah, definitely. You guys already did a lot before this happened, but this program, I think, is really a game changer, and it enables people to keep working and providing for their families at a time when otherwise that may be, a restriction that they couldn't work because they have nobody to watch their kids.
And the other thing I would add is a great need we have is simply raising awareness. I was driving to work yesterday morning, stopped at the 7-Eleven on not going to say where, but stopped at the 7-Eleven, and employee walked in for her shift with her 8-year-old there, ready with a tablet to go to work with mom. And I said, hey, we have a solution for you. You're a mission worker. Send your kids to Boys and Girls Clubs. This is unique. It's different. People don't really understand how we can operate here. It might not be common knowledge that Boys and Girls Clubs are allowed to operate, let alone operating in this unique model. So if you know a family at home that is struggling with childcare, make them aware of what we're doing. Go online, find out some information, contact me. We're here to serve, and we want to serve as many as we can.
Yeah, that's a great point. It's bringing your kids to work might be the only option a lot of people have, but then you might be exposing your children to the customers coming in, and it's a lot safer to keep them in an environment where they're restricted and they're getting adequate supervision, and they can still work on their schoolwork and everything too.
Yeah.
I do want to ask, is this going to affect the timeline for your new headquarters that you guys are working on, or do you know how that's looking at this point?
You
guys were looking to kind of expand.
Yeah, for those who aren't aware, we're in the process of developing a new state-of-the-art club for children and teens in downtown Killeen, as well as the new headquarters for our regional organization. The first phase of that was the renovation of the old First Texas Bank building, and the pandemic has thrown our completion timeline off on that by about a month. We're hoping to receive a certificate of occupancy no later than June. And we will begin to operate in that environment for kids as well as our administrative offices shortly thereafter. The second phase 2 of that project, is construction of a gymnasium, college and career center for teens, and a family counseling and therapy center for the members of the community. That is what will be impacted by the pandemic, mainly from a responsible fundraising decision. Until we can really see how this climate is going to impact philanthropy, we want to make sure that we are being prudent and beginning construction work there. And we anticipate that to be delayed probably till later this fall, rather than immediately following suit in the early summer. We don't know what we don't know yet, and that's a lot. I remain optimistic, perhaps to a fault. We will continue the success that we've already built throughout the year. But we're going to have to get creative. We're going to have to tap into new sources of funding, try to reach new partners. And I'm confident we'll be able to do so in the long term. To Marlene's point in the comments, that is the same situation. We were driving quite aggressively to establish the new Boys and Girls Clubs in Coppers Cove as well. We've acquired the land. We have a small temporary facility on that property, and are in the process of working to develop the construction plans and to supplement that with a capital campaign to complete that project. Marlene, I think the initial step, the initial product that you will see there will probably take another 12 months to really get off the ground. My bosses tell me I'm a little bit crazy, thinking I can juggle 2 capital campaigns at the same time. The same way that Killeen and Harker Heights have been impacted by their progress, Cove will experience a similar impact as well. It remains our intent to build a permanent home for the Boys and Girls Clubs in Coppers Cove. And the timeline is simply going to be delayed as a result of the pandemic.
If anyone can do it, it's you, Daniel. I've seen you in action. Well, yeah, that's awesome that you guys are still, working towards both of those goals with those locations. I have gotten to kind of see the progress in that new building in downtown Killeen. It's awesome. We love that it's downtown and it's serving that part of the community, and it's repurposing an old building.
It's blue. I love the blue.
It's blue. And I can't wait to see the finished product, as it were. Yeah. And so once that, grand opening is announced, I encourage everybody to attend. And that also is a good opportunity for future partnerships or investments if folks are interested in supporting that project after, things kind of get more back to normal and you're looking to start ramping that up again. So, yeah. Let's see. Rebecca says, thank you all for the very creative ways you're helping our community and serving every day. You and your businesses are making a difference, and we appreciate your work so very much. We definitely do appreciate everything you guys do. If there are any lingering questions from those watching, please let us know right now. We're going to start wrapping it up. Did you guys have any closing thoughts or anything additional you wanted to say? Tara, I think you mentioned in the comments that there was a hashtag you wanted to talk about.
Yeah, absolutely. Just my closing comments would just be, again, to thank you. A big thanks to the community for the support that you have been giving to our staff, to our front line. They are putting their lives at risk every day. They're putting their health on the line, but are happy to do so. There's an amazing team here at the hospital here to serve, and just knowing that the community is so supportive and behind us is very inspirational. We appreciate it very much. Yes, we have started a hashtag campaign on social media for you to express your thanks, for you to express your encouragement to the front line, and that's exactly what it is. It's hashtag is to the front line. So we appreciate it, and look forward to getting through this fight together.
Yeah, and if you're looking for some good news, search that hashtag and see what other people have posted, because I know that there's a lot of good stuff happening out there the way we are trying to honor our healthcare workers. Awesome. Linda, did you have any closing remarks or anything else you wanted to throw out there?
Yes, I'd just like to say that, you know, you hear this a lot of times from blood bankers, but summertime is right around the corner, and we know that there will be a more need for blood in the summer, because I'm like Daniel, I'm the perpetual optimist, and I'm saying we're going to be out doing a little bit more at least by summer. The other thing I wanted to say is we also have a hashtag that we've asked people to put out there to share with us if you're donating blood, or if you know someone who's used blood, or if you know, helping with COVID-19 at all. So we have hashtag Brave the Moment, and that's to say you're being brave enough to go outside and give blood, leave your home and go give blood so that others can have it there when it's needed. And again, so many of our healthcare workers even have been ended up being the patients during this time. So we just you know, hats off, and we just really, really appreciate everything they're doing. So you can visit us, carterbloodcare.org, and find blood drives, or, you know, ways to give COVID-19 convalescent plasma if you're interested, and all those things. So thank you very much.
Awesome. Thank you, Linda. Daniel, any closing remarks?
How ironic is it that the millennial here doesn't have a hashtag to share?
And go on right
I just
now.
wanted to thank the chamber. I just want to thank the chamber. Y'all have been really unique and innovative and responded to this in the same way we all have. You're providing unique solutions, aiding businesses that need it more than most. And thank you.
Well, thank you, Daniel. We appreciate that. And, you know, it's what we're here for. We're here to serve our members and our community. And we're glad that we can provide a platform for the great work that you guys are doing and help, you know, get people engaged, hopefully. So if you're listening and there's anything that spoke to you during this call, or even, you know, outside of this, if there's a way you can get involved to help people, whether it's the frontline workers, the kids that are, you know, kids of essential workers, or just someone in your community that needs a little help getting supplies, please do that. The chamber actually has implemented a Serving Our Heroes campaign. And this is another way you can get involved to help our first responders, medical workers, police officers, who are, you know, on the front lines of this coronavirus. So there's a few things that you can do as an individual. You can donate to a fund that we've created to purchase gift cards from local businesses that we will then turn around and donate to these first responders and healthcare workers. So every Friday, we're taking gift cards and giving those away. Last Friday, we gave about 140 to the police officers in Killeen. Tomorrow, we're going to be giving over 300 gift cards to healthcare workers at Advent Health, and we're trying to kind of spread the love a little bit. So we're taking turns every Friday. And all of this is from money that has been donated from local businesses and individuals. We've also partnered with Logos and Thread to sell t-shirts, which will benefit this cause. So $10 from each shirt is going to go to this fund. And the shirts are pretty cool. I don't know if we have one to show, but the link is on the chat feature. You can purchase one of those. You can also purchase shirts from a lot of local businesses who have signed up to do this as well, and then they get $10. So if there's a business you know of that's looking for a way to kind of supplement their income, have them get in touch with the folks at Logos and Thread. That's sendtextlocal.com, where you can order those t-shirts. We're also having a campaign to send cards or pictures that kids color, and we're going to give those out on Fridays, so you can mail those in. And the address will be listed on the links in our comments section, but you can mail those to the Killeen Chamber, so we'll give those directly to those workers. And then every Friday in April, we're asking folks to wear blue to support our frontline workers, and to chalk your walk, so you can write an encouraging message to folks and share that online using the hashtag Serving Our Heroes, and, you know, share it with everybody in your community as well. So thank you guys so much for being on and sharing what you're doing. Thanks to everybody watching, and just keep doing good things. Have a good day.